Hello, Kent County. I'm Dr. Adam London, Director of the Kent County Health Department. It's March 23rd, about 11:30 in the morning. I want to give you a quick update. We've now been told there's 1,232 cases of COVID-19 statewide with 15 deaths. We've also learned of a few more cases here in Kent County, bringing our total to 27 cases as of this moment. Still just the one death, thankfully. We also heard from the governor just recently with the new executive order, which is an order requiring that all people stay at home, except for those working in critical infrastructure. And that's infrastructure essential to the pandemic response effort. The order goes into effect tonight at midnight and stays in effect until April 13th at 11:59 p.m. So this is a big move by the governor, and it's a move that I applaud. Maybe it should have came a little earlier. I think that we need to take some pretty dramatic actions in this moment right now. This is not a moment we're going to get back again in order to bend the curve and to reduce the amount of suffering that is likely to happen as a result of this pandemic. We've been looking at some models, and those models show that if nothing were done, if we just continued on with life per usual, that here in the state of Michigan, there would probably be a need for about 1 million hospitalizations in the coming months, and up to a couple 100,000 deaths statewide. So that's clearly something we want to avoid by changing that epidemic curve at this moment. We believe, and the models are showing us, that by taking these aggressive actions now, we can bend the curve, and we can stay within, for the most part, stay within the ability of our healthcare systems to provide care. And by doing so, we can pretty dramatically reduce the number of people that are projected to need hospitalization and to die as a result of this epidemic. So again, it's a strong encouragement from me and my team here at the Kent County Health Department. Please take these recommendations seriously. We all need to stick together in order to minimize suffering in our community at this time. This is a chance where everyone has the opportunity to be a hero and really being heroic by staying home and by not doing a whole lot of anything, unfortunately. But that's what's needed in this moment for those who are not doing things critical to this response. A virus needs a fresh supply of new susceptible hosts if an epidemic is going to continue. And by distancing ourselves from others, we make it very difficult for the virus to find new hosts. And when that happens, epidemics like this wane. It's a little bit like stepping stones in a creek. If the next stepping stone is very close, it's easy for motion to continue forward. But if we can separate ourselves for a while, we can make it difficult for this virus, this epidemic, to continue to spread. Challenge is this is not going to be a short-term fix. While the governor's orders for about 3 weeks, most of the models show that this epidemic is going to really play out over the course of the next 2 or 3 months, with the worst of it probably hitting in either late April or to mid-May, late April, mid-May, somewhere in that window of time. Depends on a number of variables, but we're just in the early innings of this game. So I encourage you to please stay positive. Please continue to follow these recommendations, and let's work together. Also want to encourage all of you who are not listed as a critical or as an essential worker in this time. I feel some concern that we're categorizing people right now into the buckets of essential and non-essential, or critical and not critical. We're all in this together. And those of you who are maybe feeling a little less appreciated because you're non-essential or non-critical, the virus doesn't see you that way. The virus only sees opportunities for expansion. And so we all are essential to stopping or slowing this spread as much as possible. Also want to encourage you to please socialize. just don't socialize with physical interaction. I think that maybe, it was a mistake to call what we're doing social distancing. We probably should have started off by talking about physical distancing, because what we need right now is socialization. Our mental health really depends on it, especially with the long haul we're looking at. So please do what you can to socialize and to encourage your neighbors, your family members, especially those who maybe live alone. We really need to take care of each other right now. We just need to do it by maintaining physical separation. I'm Dr. Adam London with the Kent County Health Department. Thanks for watching this video. Please continue to like and share our Facebook posts, and I'll be back tomorrow with more information. Thanks.